Hi everyone, Ashok here from DHP, and with me is a very special guest, Dr. Eric Yarnell, joining me to talk a little bit about the naturopathic approach to urology and men's health. Dr. Yarnell is a naturopathic physician with over 20 years of practice experience. In that time, he has also taught at multiple naturopathic medical schools in the fields of gastroenterology, urology and men's health, botanical medicine, and pharmacognosy, and more. Along with that, Dr. Yarnell, as a writer, has published several educational textbooks for students and practitioners of natural medicine, while also contributing to numerous more texts, research, and articles. He is a highly respected doctor in his profession, and I am super excited to have him here today to share some knowledge with us. So, welcome.
Thanks, no pressure.
No, thank you for being here. So, first of all, let's just kind of describe urology and men's health. Urology is a relatively well-known term in the medical world, but men's health is not a very common specialty.
Yeah, it's true. And particularly, of course, in naturopathic medicine, where we're something like 80% women, I can understand that. And of course, there's been a lot of emphasis on men in the general culture, and I think rightly there's a lot of, therefore, sort of, wait a minute, but women's health needs to be focused on, and that's good. So one thing I want to make really clear at the outset is that it's not either or. But anyway, that men have unique health needs, different than women, and a lot of them the same. And anyway, so this is not just looking at sort of the male reproductive organs, although that is a big part of what I do, but it's also sort of taking care of all the other aspects and trying to help men just navigate their way in the world. And I think it's nice when you can feel comfortable with your doctor and talk about difficult emotional issues or relationship issues, as well as your prostate, all those things. So, So I do see women, of course, because I do deal with basically problems with the bladder and kidneys, but the majority have been working with men.
Okay. And what got you interested or involved in urology and men's health? Like, were you always drawn to that, or was it something in medical school that made you?
A little bit of a funny story. I was interested in men's health, and sort of this men's movement that kind of happened in the 80s and the 90s, and not as a reaction against feminism, but seeing like, oh wow, feminism, that's awesome, it's really helping women, but we also need to sort of raise men's consciousness about how we can be a progressive force in the world. So I was interested, but I actually, when I started at naturopathic medical school, I decided I wanted to be a midwife. And everyone's like, forget it, that's not going to work. Even though there are male midwives, and like Rick Posmanter, like I know that, and now Elias Cass, but anyway, I just basically didn't listen, and I started taking the classes. But I did my first birth, and I was awake for like almost 3 days, and just like, nope, not doing this. I need to sleep. Like, I'm not cut out for this. So then I was sort of like, well, now what do I want to focus on? Because that had been so much part of what I was doing, and I just noticed, like, really at that time there was basically no men's health class. It was like 2 weeks of the urology class. I'm like, this doesn't really make sense. Like, I get it. Again, women's health has been kind of overlooked, and it needs to have a lot of focus on it. We had 2 classes in women's health. I'm like, but that doesn't mean we should just ignore half the population, essentially. So then I just started really researching myself, and at that time, like, no one was doing this. So it was very difficult to learn, but I found it fascinating. And I was clearly helping men, right away. And one point I like to make about that is, a lot of people say, well, men don't go to the doctor. How is that going to work? And what I came to realize is they partly don't go to the doctor, and I knew this is partly my own issue, because the doctor didn't know anything, right? Like, they didn't know about men's health. Like, they couldn't really help me that much. They weren't trained. It was like, so a class example is like, all they knew about for an enlarged prostate was this herb saw palmetto, which is a very famous herb, and that is a true thing. But if that didn't work, just shrug their shoulders. Like, well, that's all I've got, And I'm like, I know there has to be more than that. So anyway, all those factors kind of drove me into this realm.
Very cool. That's awesome. I'm also interested in it. So, and I've kind of seen that, and I've gotten the opportunity to learn from you, which has been great. But I guess from the 80s and 90s till now, you've been practicing for over 20 years. How has the field evolved? How have you seen it change? What have been some of the trends?
Well, now there's not just me who talks about being sort of a men's health specialist. There's a handful of other MDs, of both women and men, which is also something I think is really important, that this is not just about sort of male doctors with male patients, that just like there are a lot of men who do women's health, it's not like that. You can understand someone else's problem. And so that's really good. It's still really small, but there is awareness. And now, although the class now at Bastyr is even called the male reproductive module. Like, it's a recognition. It's not just a piece of urology. It's its own thing. So I think there's a lot more awareness, definitely in the public, and I think that's really. I mean, it's hard to know because I'm in Seattle, where we tend to see a sort of greater consciousness among men. But I feel like there is a greater awareness in general that men should go to the doctor. The doctors are better trained, so there's something to gain from that. Just that it's all around been a win-win. But it's still too slow of a pace of change for me, and still too small. Like, we really still have a huge need in this regard.
Interesting. But overall, you've seen, I guess, an increase in popularity, acceptance, the amount of conditions or different tests and assessments that have come out?
Absolutely. Yeah, definitely. And I think part of that is driven by sort of prostate cancer awareness and the PSA tests, of course, which came out in the mid-'80s and sort of paralleling what happened with breast cancer in women and the development of mammography, as a test to detect breast cancer early. Like, that sort of made men realize, I shouldn't just wait till this cancer spreads all over my body to do something about it. I should be proactive.
Yeah.
And I especially love that because now that's an entry for me to talk about preventing prostate cancer, which is a piece that's still just completely absent from conventional medicine. Not completely, very absent. This idea that we should focus on prevention. So when I see younger men, I talk about, part of the reason to eat vegetables now is to not get prostate cancer in 20 years. And so I love that. And they get it. More and more men are like, that makes sense to me. Like, I get it. I need to establish these healthy habits now that can last a lifetime, and it's not like you get cancer and you start eating vegetables and that's it. Your problem is solved. It really takes years of this change to really work.
Interesting. And I want to come back to that. But on that topic of trend, and you were saying, you started looking at research when you started getting into it. How has that evolved? Has there been more research and information actually available from that side too?
So much. Yeah, it's really increased. And I don't know, there's a little bit of a fight about this in terms of like, does women's health get more research money than men's health? And again, it's like, let's not fight about it. Like, you can legitimately see there's an imbalance, but it certainly has increased, and it's enough that I, just recently published my basically men's health textbooks in 2 volumes, and they're almost 2,000 pages long with 10,000 references. And that took 16 years to compile, but it was there, and it's definitely growing all the time. I mean, keeping up with just the research on prostate cancer, prostatitis, and enlarged prostate could be a full-time job. I mean, there's huge amounts that come out about those. So, it's been much better. The other thing that's really interesting is the sort of change about male infertility, which maybe we'll get to later, but just it used to be sort of like, whatever, it's always the woman's fault. And now they're realizing, it's a 50-50 here. We should maybe look at men sometimes. And just the research explosion in that area is another great example.
Very cool. Very interesting. Okay, so you kind of alluded to this already, but how exactly does it fit into your practice as, first and foremost, a naturopathic physician? You specialize in a little bit in the urology and men's health area, but when you take a step back and look at your practice as just a physician, what principles of naturopathic medicine really come up most strongly to guide your practice?
I think a lot of what I do, and again, maybe I'm deluding myself, but what I try to do is sort of this idea of find and treat the cause. I don't like to just say, here's something for your symptom, although I do that because we don't want people to suffer. I don't want to just say, well, this is what sort of standard. It's like, why for you did this happen? And sometimes we can't figure that out. So especially with cancer, it was probably multiple things that happened many, many years ago. So there you have it. But even then, I still think, though, some of those influences we can change. Again, dietary things, whatnot, so that we're not making the cancer worse. But definitely with prostatitis, enlarged prostate, male infertility, like there are many times where we can find the causes and get rid of them, and then the person can potentially be cured. That's a heavy word, but why not go for trying to completely get rid of their problem? So that's important. And then I really, as I already mentioned, the sort of prevention as a principle, and we don't just focus everything on what's happening right now, but also try to make changes, often that do both, right? It's like, this is going to help your current situation, it's going to help your symptoms, it's going to help this problem go away, and it's going to prevent heart disease and other kinds of cancer. And so we're always looking for those kind of crossovers, and I think I love that.
Yeah.
And it's one thing that's tricky about that is it's hard to see the results, right? Like, you don't see that you didn't get colon cancer. You just didn't. Yeah. But everyone gets it, though. They're like, I want that outcome, even though I know it's not an immediate response. It's not a golden magical pill or a silver bullet. But they can see that their health is better. And also, the outcome I do hear a lot is sort of increased vitality from these kind of generic measures. So, which is making me realize part of the principle that I just do, I can't help, is the sort of principle that the doctor is teacher.
Right.
Yeah.
So from the naturopathic standpoint, we don't always treat conditions. We're kind of treating the whole person. We're treating the individual for their health. But what are the most common conditions that end up walking in your door in your naturopathic practice?
I think because I'm a professor at a naturopathic medical school, and I speak at conferences all over the world now, and all my writings, that I've become kind of a referral doctor. So most of my patients are referred by other naturopaths or students, and therefore I tend to see more complicated and more disease and less of the preventative stuff. So I see a lot of patients with prostate cancer. That's about a third of my practice, and then a lot with other prostate conditions. Those are really common. And now more and more, as I kind of said before, I'm starting to work with patients with kidney disease, which a lot of course, is scary for people, for the patients that have it, and also for doctors, because it is an area where there's not a lot of understanding, and obviously the stakes are high if things don't go well and the kidneys get worse. So that's been a lot of it. But definitely, certainly erectile dysfunction. Peyronie's disease, which is a disease of the penis. I said that, but male infertility is also something I see a modest amount of. And just a random assortment of other things, bladder infections, which are often related to enlarged prostate in men, kidney stones, the whole range. So
a big wide range of conditions, and it would obviously take forever to go through each of them, but maybe on a more general level, or some of the more common ones out of those, what is the conventional treatment like, and how does it compare and contrast with like the naturopathic treatment? How are they different, or how are they similar?
Yeah. Well, boy.
I know, loaded question.
I'm on the warpath about some of these. I think the two that are most clear would be the difference, where there's really stark differences, would be with prostate cancer and chronic prostatitis, or inflammation of the prostate. Which I actually want to start with that one. So chronic prostatitis is a complex condition. It's almost certainly actually multiple diseases that are kind of been lumped together. But in conventional medicine, for a long time, there's just been this theory that it's a bacterial infection of the prostate, and so the treatment is to give antibiotics. And a small percentage of men do have a bacterial infection, and that treatment works. And that's great, but more and more evidence is confirming what I see clinically, which is that for most men it doesn't work. Or they get temporary relief for their symptoms, and then it comes back. And they're right back in your office 3 to 6 months later with another flare-up. And it turns out part of why that is that a lot of the antibiotics they use are also anti-inflammatories. So they're not just killing bacteria, and that helps them, to feel better, but it doesn't fix the problem. And there's been this dogged determination that no, an antibiotic is an antibiotic. And it's like, wait, why not this other perspective? So anyway, that's led me to look into sort of the deeper roots, getting back to that sort of why does it happen? Yeah. And it's a kind of a crazy, complicated story. I know you've heard me tell it to patients, but that a lot of times the problem actually starts in the gut with this problem called leaky gut. And I know that's kind of a buzzword, but this is based on research. This idea is not a traditional idea, really. It's something that scientists discovered, these sort of microscopic leaks in the intestines, which then when food molecules go through, the immune system sees these things that they would normally never see, and they really get upset. And then those cells migrate, in this case, to the prostate and provoke all this inflammation. So it's funny, the patient comes in expecting some treatment focused on the prostate area, and it's like I'm talking about their digestive system. But they're interested because a lot of times they've been going through treatments for years, not getting better. And it's like, well, if this will make me not have this pain, I'll try it, even if it sounds kind of crazy. And more often than not, it really is curative. It's able to completely get rid of the condition, which, again, that's, I think, the goal ultimately of everything. Yeah. So it looks completely different. It involves dietary changes. And I do use some herbal things to help reduce pain. And I should say there's another little subset that's interesting of men with chronic prostatitis, or what's also called interstitial cystitis.
Right.
Which is that they might have a problem with the muscles in their pelvic floor, and really that they're too tight. And so there's a completely different treatment using some hydrotherapy, magnesium, and some herbs to help relax those muscles. And so I've seen that several times, and that's really rewarding because it works immediately. After then, they are often frustrated. It's like, why did I suffer for so long when I could have just done this simple program and been cured? Right. So prostate cancer is another one that is a big one. And there's been so much media attention about this. I think it's something that a lot of men can really understand. But there's confusion too. So the issue, the main fundamental issue is that prostate cancer, again, is not one thing, that there are different types. And as is true of all cancers. Right. But what's really different about this one is that most prostate cancer is non-lethal. We're all sort of used to thinking of cancer as this very deadly disease. Yeah. And there is a form of prostate cancer that's very deadly, but that's maybe 20% of men who get prostate cancer that actually spread and threaten their life. So that other 80%, it doesn't. And this is very well documented in many, many research studies. This is not a theory. This is not an idea that I had. This is a growing consensus. So much, though, that an article in one of the major conventional medical journals last year said, we need to stop calling low-grade prostate cancer cancer. Right. It doesn't behave like cancer. It doesn't spread. It doesn't kill. The word cancer just scares men. And the same thing could be said of breast cancer in women. It's very similar, and it's the same problem. And the same article argued, stop calling low-grade breast cancer cancer, because it isn't. So that I work with a lot, just trying to say you don't have to necessarily have your prostate out or radiation unless you're so anxious that you just have to have that. Right. But that we can almost always do natural treatment and monitor to make sure it's really working. Right. I'm not so foolish, because some men have early aggressive type cancer, and we want to make sure we detect them and send them for the proper treatment, which is a prostate removal surgery, radiation, hormone therapy sometimes. So that's been a big part of my practice, and I feel like that's been really rewarding, because you can see now, since I've been doing it for so long, I have many men that are alive 10 years later. It never spread. It exactly followed what we know happens, and they were spared from having this very serious surgery or radiation. So
amazing.
That's wonderful.
Yeah, absolutely. That is incredible, and that's so rewarding for the patient to not have to do such a high force intervention right away, which actually segues really nicely into what I was going to ask is, when you look at the treatment options that you just kind of talked about, and even going into the conventional ones that are very often, or not very often, but sometimes are needed, how do they fit together? Like, how do you use the therapeutic order to put together your treatment plans, and where does the force of intervention kind of compare from the naturopathic approach to the conventional, or the mixture of the two,
Mm-hmm. Yeah, it's something that this comes up all the time, and I like this sort of model definitely for presenting this idea to patients. I think it really makes tons of sense that we try to use the least force necessary. Like, that's, to me, is the overriding mantra. So if we can fix a problem by a change in diet, why wouldn't we do that over surgery? Where you run all the risks of having surgery that go with that, and it's irreversible usually. So, so in the case of prostate cancer, with this low-grade type, basically I try to gather more than just a PSA test, by the way. This is based on usually a prostate biopsy and or imaging of the prostate. We do other blood tests to try to get a sense, like, okay, yes, for multiple tests, say, this is the low-grade kind. And then we also have those to compare to in a year or two to make sure it stays low-grade. And then we try the sort of milder dietary treatments, vitamins, herbs, and as opposed to rushing right into prostatectomy, which may not be necessary for this, probably isn't for this low-grade type. Versus, if the patient comes in and, unfortunately the biopsy or imaging tests show it's aggressive, that it either has already spread or it looks highly likely to do that, then to me the least force, to extend their life, preserve it and extend it, with the lowest risk is surgery or radiation. Right. And then my role becomes to do things on the natural side that sort of mitigate those risks, help both lower side effects, but also make it work better. That's something I think a lot of people haven't thought about, but there is evidence to support that we're really trying to amplify the effect of those conventional treatments. So surgery is a very high force intervention, obviously. There's many attendant side effects, in this case, taking out the prostate. Often there's problems with erectile function, incontinence, pain, infection. There's lots of things. And so we're trying to, with herbal treatments, with diet, to counteract those things, while treating the whole person's body, because the surgery only treats the prostate. And we're especially concerned about sort of micrometastasis, that the cancer might have snuck out in very tiny amounts before we removed it. And so by using treatments that are safe but treat the whole body, that's a really nice augmentation. And the two go together. They're not separate, they're really combined. So I don't see it as a conflict. I really see it as a way to, for two disciplines to help people the best. It's not about our egos, the patient.
Very cool. And that's wonderful to see that they can fit together so nicely like that, given that the people have the education to know that that's there, and it comes right back to you saying, being the doctor as a teacher, educating the patients on options and availability. So you kind of alluded to it, but it looks like from your side, the main, most common treatments that you'll end up using are a lot of that diet, lifestyle, and herbal medicine. Yeah.
Yeah, I love herbs.
Yeah.
And then to me, the diet and lifestyle is that's foundational. Like, I don't know how anyone cannot do that stuff. It's just, it's so obvious. The benefits are so clear. So many patients come back like, wow, I had no idea if I stopped basically eating poorly and a lot of processed foods or junk foods and eating out all the time and start eating a lot of vegetables and homemade meals, like they just feel incredibly better in ways they had no idea, or they just got used to feeling sort of low energy, their sleep isn't that good, and it's transformative. So anyway, that's crucial. But I do love herbal medicine.
Yeah.
And, it's a funny thing because I point out, like, the beginnings of drug therapy are from herbal medicine. Many of the first drugs, in fact, all the first drugs were herbs. So digitalis is really a famous one. And a lot of people think of aspirin, even though that's synthetic, but it was based on herbs that have salicylates in them.
Right.
Belladonna yielding atropine, all these things. So there's very powerful herbs that can have immediate, obvious effects. They can really help patients' symptoms and sometimes, really help fix their disease. And then there's all these wonderful other herbs that are much gentler and they take much longer to work. And there's nothing like this in conventional medicine. So I think it's hard, both for conventional doctors to understand, I can only get it. And also patients like that. You need to take this for like 6 months to a year before it works.
Yeah.
We're so used to like,
quick
a week,
fix.
a month. Like, come on, I don't have a year, but we do. And these are the kind of herbs that sort of help us deal with stress. They help our sleep be of better quality. And those are things you don't feel instantly.
Right.
Or notice the benefit of. It's like, oh wow, I didn't have any colds this last year. I always have 3 or 4. What changed? Oh, I've been taking this herb that kind of helps my immune system work better.
Right. Yeah, I absolutely love herbal medicine. I wish I could just sit here and talk to you for an hour on herbal medicine. Maybe we will one day. Maybe we will if I can convince you to come back. No, that's great. That's so nice to get a little bit of an in-depth, even that brief, but in-depth look at kind of how the naturopathic approach to urology, men's health, and just naturopathic care is so easily integrated into what people are used to already. It's not a different world. That's right. So thank you for that. Now, here's our part where we give you, where I like to give you a little chance to get on your soapbox. So I want to know what you would tell people the top 3 things to avoid or stay away from to promote good health, whether they're related to, this topic or just in general.
I kind of want to say the internet. Obviously there's good and bad, and the problem is being able to filter out the garbage. So I think what is most important is you're looking at something on the web, it's always asked, who is saying this and why? And if it's, you don't know who's saying it, first of all, there's no name attached, there's no person, or it's just a company, you got to be skeptical of that, because their incentive is to make money, not to help you, unfortunately. So unless you can verify something by multiple means on the internet, with attributions to a specific person, it's like if they say research shows that this product works, it's like, and they don't tell you what the research is, there's no research, or it was just done in a test tube, and that is not relevant to people really. So it's like, what are the details? Who's the name behind it? Anyway, but be very skeptical of claims on the internet that sound extraordinary, because they probably aren't accurate. I just see a lot of people who spend a lot of money on things that don't help them, that are dubious, and particularly scary would be supplements for sort of erectile function on the internet, which many studies have shown are frequently adulterated with drugs. So you're taking something that's dangerous because you don't know the dose, you don't even know what you're taking. And you could have serious side effects. So it's better really to get a professional recommendation, or at least to find something that, again, you can validate by multiple routes, like multiple authorities who know something about something say this is a good product, that it's safe and effective and that's a lot better. So I do want to empower people to be able to look into their own health and understand it, but also the more complicated it gets, the harder it is to do that without a lot of study.
Right.
Okay, so number one.
Yeah.
So I think number two is kind of letting yourself get into bad habits. I don't know exactly how to say that, but so I think exercise is the best example. Like, we just get used to not doing it. It's like, it's just so easy to not do it and just to, I'm just gonna, I need to do this, I need to do that, I need to do this work, and I'm guilty of it as much as anybody.
Yeah.
Writing a textbook involves a lot of sitting. And so anyway, it's creating those niches or those times that you do beneficial things, like, I'm just gonna always do my 15 minutes on my treadmill every day, that's this time, and it just becomes a thing you do.
Yeah.
So avoiding bad habits. And of course there's others that are more obvious, like smoking and things that, there just really is no upside to that. So really trying to avoid those things.
Yeah.
Third thing to avoid, that's a good one. I guess I'm going to go with processed carbohydrates. No matter what you think, they're not going to help your health.
Yeah.
They taste good, I get it. I like sugar. It tastes good. But it's pretty much all negative. And that's just such an obvious one. I know people hear it all the time, but it really bears repeating. Because it is so problematic.
No, and that's good. Hearing it as, for example, one of your top 3 things to avoid, and that repetition, like you said, it can't be said enough. I'll agree with that for sure.
And I'll point out again the strong correlation between blood vessel health and erectile function. Like, the arteries have to be able to deliver blood to the penis. If the blood vessel is compromised by atherosclerosis or hardening of the arteries, it can't do that. Mm-hmm. And what drives that is one of the many drivers includes processed carbohydrates, but also sedentariness and not exercising. So it does affect a lot of the body that we don't intuitively think of necessarily.
Yeah, and smoking. Right. So, okay, wonderful. I like those. So the next 3 is your 3 daily tips or daily practices to promote balance in everyday health.
So one is to pursue what you love. And every day there's got to be some piece of that. It may not be profitable. It may not be required. There may be competing interests, but there has to be something. For me, it's a weird one, but I really like reading research, and I don't always want to read it about, I have to do X. But I like to just kind of browse. So I just, no matter what, it's like, I'm just going to take some time and just do that. But obviously, frequently, it's just making some time to snuggle with your sweet one, or anything like that, where it's just really is important and something that brings you joy. So I think that's really important. Can I say the exercise one?
Yes.
And it's tough, but really every day you need to move. Mm-hmm. And it doesn't necessarily have to be running a marathon. You don't have to get all sweaty and hot, and it's a big ordeal. But some level of that. And again, I'm guilty of not doing it. I'll get into a groove like, I've got to meet this deadline. I'm writing a book. And I've got a chapter to finish. And so I'm not trying to make anyone feel guilty. But the truth is that was the norm for all of our history, that people move their bodies a lot. I don't even want to use the word exercise, because everyone thinks of that as I have to put on special clothes. I have to go to a special place. It takes all this time. And it's like, no, I'm just talking about do a 15-minute walk after dinner. This does not have to be a giant ordeal. Again, partly to fill that habit piece that I was saying before. And then, I think I have to go with eat your vegetables every day as my third one.
Eat your vegetables.
Your mother was right, your grandmother was right. This is crucial. It affects, every condition. There is not a health condition where this is not an issue. I mean, it's weird because there's one thing I deal with, which is sort of late-stage kidney disease, where vegetables actually become a problem.
Right.
Because the kidneys can't process the potassium and that builds up. But every other situation, it's like the key fundamental piece to really help the person get better. So yeah, and for prevention, you just can't, overlook it.
Yeah.
I want to point out with both exercise and high vegetable containing diets. So there's Mediterranean diet. There's a lot of versions of this.
Yeah.
Even the paleo diet really is a high vegetable diet. It's not mostly animal products. It's mostly vegetables. The research on this as prevention shows that they are so much more effective than any drug.
Anything else?
Like you look at a statin, which sure, there's research that shows they lower risk of heart attacks and strokes, but the exercise is like 10 times stronger than that. So if you're not going to do that basic thing, you're going to get into trouble.
Right. The foundations, right? The foundations of health. I like it.
Never go away.
Never go away. Great. Okay, and the last set is your top 3 just tips for optimal health. It doesn't have to be daily practices, doesn't have to be, specific to men's health or anything, but just in general, 3 tips that can optimize somebody's health. So
I really think these herbs we call adaptogens are important for most people. So what that adaptogen word means, they're helping us adapt to stress.
Okay.
And there's a complex literature on how they do that. A lot of people just think, they just help your adrenals work, but it's way more complicated than that. Anyway, we all have stress. Even people who like, I'm not stressed, I'm retired, feel good, but just driving is stressful. Like traffic is stressful. People are crazy out there. But most of us do have stress from work, from school, from relationships, whatever. So these are just a nice way to help us deal with that, because it's not going to go away. The stress is going to be there. It is important to have techniques for coping, but this is one piece that I think really helps. And the side benefit is they are, as a class, herbs that help us help our immune systems to really be their best. And it's not a simple matter of more or less. It's really kind of fine-tuning all different parts of the immune system. So, for example, helping prevent influenza, helping prevent cancers. And there's a rich literature on this. So these are things like ginseng, devil's club, astragalus, schizandra. There's so many. My favorite one, gotu-kola, which I talk about all the time. So, those I feel like most people can and should take regularly because of these preventative benefits, if nothing else. I think water is another sort of optimizer, and someone who deals with a lot of urology problems, I see this. But I've seen conventional providers on TV and stuff, or on the internet saying like, there's no evidence that you need to drink 8 glasses of water a day, and that I'm like, what? Like there is, like just preventing bladder cancer and preventing kidney stones. Again, there's ample research saying if you don't drink a lot of water, you're at greater risk of those diseases. Right. So I'm like, there's clearly 2 common diseases that more water prevents. And more water doesn't prevent all disease. I'm not saying that, I know that. But the other benefits I see of that is sort of displacing other beverages. So of course, we have soda, even diet soda, like all these things that people drink that really aren't very good for them. Even fruit juice is really a problem. It's a lot of calories with really not a lot of nutrition, depending on how it's made. But just sort of the commercial, highly processed fruit juice is not healthy for most people. I see that kind of benefit of really, I mean water when I say drink water, not just drink liquids. There are other beverages that are healthy. I mean, I personally dislike coffee, but a cup of coffee a day, there's a lot of benefit to that. 3 a day with a ton of sugar and milk. But green tea, obviously, is another benefit. We have another beverage. We have a lot of research showing is really a net benefit. So, if someone doesn't like water, there are ways to get water with flavor that are acceptable. And herbal teas, there are a lot of delicious herbal teas that are a net benefit. So drinking more water. It's not 8 glasses a day. What does that even mean? What's a glass?
Yeah.
Some people drink a glass this big, and some that's like 80 gallons. So what it really is, you need to drink enough that you have to urinate about every 2 hours when you're awake. And that's a much better way to titrate that. Because some people it takes less water than others, depending on their bladder size, etc.
Right.
So that's what I usually try to say.
Okay.
And third thing is sleep. Again, kind of a foundation of health. And it's, there is a lot of study of sort of what is optimal, but I think that's the thing that gets sort of pushed aside. And again, I know from my own life, if I'm really under pressure to get a project done or whatever, I tend to say, well, I'm just going to go to bed an hour later. But I pay for it. I really feel it. I know I'm not as functioning as well as I could be. And we now know from ample studies that it increases cancer risks and heart disease and all these things. So really getting optimal sleep. And that doesn't just mean time. It means that we're really in deep sleep. And so sometimes that means we need to make the bedroom darker to help our own melatonin synthesis be right. Or sometimes we have to use these nervine herbs that really help us go into the deep stages of sleep more effectively. But basically working on that is, I think, really crucial for optimal health.
Wonderful. This little section is always my favorite part of when I get to sit down with doctors, because I'm like writing all these tips down. I'm like, perfect. I'm getting everybody's top tips, so I get to learn as well. Dr. Yarnell, that was fantastic. I thoroughly enjoyed hearing about that, as I'm sure people that watch this video will as well. And before I let you go, I got to ask, where can people get more information? I know people are going to watch this and say, oh, I want to learn more about, urology or men's health or what you do, or maybe, things you've written or research that you might be working on or publishing. What can they do to learn more? Where can they go?
So I have a private practice, and my website, I have blog posts on there. I'm not a prolific blogger, but as something important comes up, so a few times a year. That's called Medela Optimal Health, which is Medella, which is like an old-fashioned word for sort of inner strength kind of idea. Anyway, so that's a major place that kind of, if people want more that I'm dealing with. And then I'm just all over there. Like, just Google my name if you want to see what I've written, which is often targeted towards practitioners, but there's a lot that's in there that sort of patients and folks that aren't as medically trained would take away and be interested in.
Awesome. Well, again, thank you for being here. This was great.
My pleasure. Thank you.